Hello, this is Adrienne Miller. I'm a competent woman here with Tuesday Talks on Facebook Live. Today, I am here to talk about our topic today is the disease debate. And so this is a hot topic in the addiction field, and I just thought we could chat about it for about 10 or 15 minutes. I am an intellectualizer. I love thinking about things. You're going to see me get a little bit nerdy. Sorry. So what is the disease debate? And this is like been going on in the recovery field since the beginning of the recovery field. I'm pretty sure is addiction a disease? Um, and so I'm just going to unpack that just a little bit with you tonight. So what is addiction? When I went to school for addiction counseling, the most basic definition that people could come up with was continued use despite negative consequences. And that is kind of the core basic, if you're really going to boil it down, is continued use of alcohol or any other drug despite negative consequences. So then we also want to look at what is a disease. And so I looked it up in a couple different dictionaries, and they were all basically the same, right? An illness or a disorder of function or structure in an organ um, or an living animal or plant body or one of its parts that impairs normal functioning, typically manifested by signs and symptoms. So that's what a disease is. So does addiction fit that disease definition? First, I want to rewind just a little bit to the historical context of the disease model because context matters, right? So the disease model evolved in kind of the mid 1900s, and it was a response to what we addiction historians call the moral model. So the moral model was developed in the late 1800s and early 1900s and basically said it's amoral to consume alcohol. It's an amoral decision to consume alcohol and to consume it to excess. It's a sin. It's bad. It should be outlawed, right? And so they did. They actually outlawed alcohol, but that was the moral model. It's wrong. It's the wrong thing to do. And so, as you can imagine, that was very stigmatizing of people who used alcohol or people who used drugs, right? And it turned them into bad people. And so the disease model evolved to explain addiction in a different way and to kind of destigmatize it, right? So these aren't bad people, they're sick people. And the disease model really looks at, right, what are the signs and symptoms? So continued use despite negative consequences, cravings, compulsion to use, difficulty with decision making, that kind of thing. So if we look at that and we look at the brain as the thing that is dysfunctioning, then we can see how that could fit the disease model. So the brain is dysfunctioning with these predictable signs and symptoms and needs treatment rather than punishment. More recently, since we don't like to talk about morals so much, we tend to talk more about choice. And so in some of the more recent thinking and writings, they talk more about the choice model. Is it a choice to use? Is addiction a choice? Or is it this uncontrollable disease? So there's a couple different viewpoints. One that's very interesting is that addiction is an attachment disorder, right? That people aren't getting the attachments and the relationships that they need in their life, and so they develop this attachment to their drug. And of course, when I say drug, I mean alcohol as well. So they develop this attachment to their drug in lieu of attachments to other people and relationships with other people. And of course, a lot of us have seen the TED Talk with Johann Hari, where he says the opposite of addiction is not sobriety, the opposite of addiction is connection. And this is kind of in that addiction as attachment disorder realm. There's also a lot of talk about addiction as a learning disorder, right? So it's this abhorrent learning. We've There's something wrong with the brain, or Dr. Mark Lewis says there's something right with the brain. The brain is doing what it's supposed to do. It's learning that you get a positive effect from the drug, and it just kind of learns it a little too well, right? So, what I think is really interesting about the learning disorder model is when I was in college getting my psychology degree, I took a class called Learning and Memory. And psychologists love to study these different models, right? So the disease model, or um, you hear about like the pigeons that peck the bar and they learn to get a treat, and that's a behavioral model. So in this course, each chapter of our book was on a different model of learning, a different kind of explanation framework on how humans learn. And single chapter, every single different model of learning or explanation for how we learn, they all talked about addiction. And this was not an addiction class, this was a learning class. But every single model of learning looked at addiction because it's just such this like weird derangement of the normal learning process, right? We learn way too well that drugs and alcohol are the solution to our problems, right? So there's the moral model, there's the choice model, there's the disease model. Which one is right? I kind of like the biopsychosocial disorder model. And this is the guy who described PAWS, the post-acute withdrawal syndrome, Terence Gorski. He talks a lot about the biopsychosocial disorder model. And I really like that. He might even call it the biopsychosocial disease model. Um, I like it because it doesn't oversimplify, right? I think it's way too simple to say addiction is a physical problem, right? Because if addiction was purely physical, then like my grandma who goes into the hospital for a broken hip is going to come out an opiate addict. But that's not true, right? We see tons of people going into the hospital, being given all these drugs, and they don't come out addicted, right? So it's not just physical. Is it psychological, right? Well, not everyone who has addiction has trauma in their background, has a difficult childhood, or has a comorbidity like depression or anxiety that they're self-medicating, right? That's not true. And not everyone who has, say, anxiety and depression becomes addicted to a substance, right? So we can't really say that it's just a mental process. And social, we can say that social affects it, right? So if I live in a culture that has no alcohol or has no access to cocaine, it's going to be really hard for me to get addicted to cocaine or to get addicted to alcohol because I live in a society that doesn't have any access to it. But if I live in a society that does have a lot of access to it and easy access, then I am more likely to develop an addiction. So I like the biopsychosocial model because it really takes into consideration all of these things. And it doesn't say it's just one thing. It says, right, so the physical drug is affecting this, and so is some of the mental processes around it, and so is some of the social factors around it. So I really like that. From WFS's perspective, we did change the thought action for statement one from uh, I now take charge of my life and my disease. I accept the responsibility to I now take charge of my life and my well-being. I accept the responsibility. And part of that was to just kind of get out of this disease debate. Um, because people can really get stuck on, is it a disease? Is it a choice? I had a client who asked me that once. I said, you can call it an aardvark for all I care, as long as you're willing to do something about it, right? So why does this really matter? And of course, the simple answer is that by understanding the causes of addiction and why it happens, we can prevent it and we can treat it. And that's totally true, right? That is really going to help. And science has made a lot of advances into medications and treatments that are very effective in treating the disorder of addiction or the disease of addiction or the state of addiction, whatever you want to call it. There's also some other really important things that shifting from a moral choice to a physical disorder does, right? And the most important one, I think, in our culture especially is at the public policy level. So it used to be, drunks were sent to sanatoriums, they were locked away, or they were locked away in jails. They weren't treated. Doctors didn't want anything to do with them. They sent them away and they were locked up, right? And so when we're looking at the moral model, that makes sense. These people are making bad choices. They deserve to get locked up. Now, when we shift to a more complex disease or psychosocial model, now these people who are using, despite their negative consequences, they now become patients. They now become people who need treatment and new strategies and maybe medication support or whatever, right? So on a public policy level, this is really, really important, whether we're going to call this a choice or a disorder. Really important. And I can't talk about this without talking a little bit about the drug war and the disparate impact of the drug war, because I think it's really important that we just acknowledge that while use rates are typically slightly higher for whites in America, nearly 80% of people in federal prisons and nearly 60% of people in state jails for drug offenses are Black and Latino. So even though our culture is shifting away from the moral model and into the disease and disorder model, we are still um, we're still trying to punish our way out of this, right? And if you look at the definition of addiction, continued use despite negative consequences, giving these negative consequences is not going to stop the addiction by its pure definition. So I think we really do need to look at that. And this, public policy is important and it does have very real impact. And it has disparate impact for our sisters of color. So just needed to throw that out there and name that. And we also see that like with the opioid epidemic, it's had very different treatment than the crack epidemic. The crack epidemic was all, throw them in jail, increase mandatory minimums, all of that. Opioid epidemic, let's increase treatment options and accessibility to treatment. So I just need to own that as a human being in our culture. And so we can broaden this out from the public policy level if we're looking at why does this matter. We can also look at kind of the broader community. So even when you just are, if you're not a criminal or have a criminal history, even just reintegrating into society after getting sober, right? You might have big gaps in your resume. You might have to go away for treatment, right? So looking at employability, job applications, credit history, all of that, right? So there's, at the community level, there's implications for whether or not we're going to stigmatize people with addiction or whether we're going to treat them as people who were sick and needed help. My last little point, I know I'm going a little long today, but like I said, I'm super nerdy about this. Um, my last little point is when we're asking, do you think addiction is a disease? We also have to look at who is asking, right? So I see this question from family and friends a lot, and they're usually trying to figure out, is this my fault? Is there something I could have done to change it? Children will often try to figure it out. Am I going to have the same problem as my mother or my father? How can I support them in fixing it? And so I think that this question can be important in those respects as well, and also kind of relating this out to the person with the addiction themselves. You know, accepting addiction as a disease or as a physical or mental health disorder can really help reduce some of the shame and guilt over it. So, both for the family member and for the individual suffering from addiction. And that can be really handy, right? Because what we know, or what anyone in Women for Sobriety probably knows, is that the shame and guilt of having an addiction can really hamper our ability to move into the solution, right? And to practice a healthier way of living. So I think it's important for me accepting that my addiction was a disease, and I was very comfortable calling it a disease or some kind of physical disorder. That really helped take a lot of the shame and guilt out of it for me. And so I was able to move past that guilt. Yes, I made decisions early on to drink or to use drugs, but then it quickly got out of my control. Um, and and so that was very helpful for me. It may not be helpful for you. Other women, they say, I don't want to think of myself as being diseased. I want to just focus on what I need to do to get better. And that's fine too. If it doesn't help you to think of it as a disease, like I said, you can call it an aardvark for all I care, as long as you're willing to do something about it. Take responsibility for your recovery. Um, and I'm just gonna throw this out there. The other time I see people asking this, sometimes they're trying to justify using again. So if this is a disease and I've cured it, now I can go out and use. And I just um, really want to caution anyone who wants to justify being able to go out and drink or use again by saying, well, it's not really a disease, it was a bad habit, I'm out of that habit again, and now I can go out and do this again. Just be really careful. I had someone ask me in the beginning, is it worth it? Would having that drink, is it worth risking everything that you've built your life up to be for that one drink? Is it worth taking the chance that it could take you down that path again? For me, it's absolutely not. Absolutely not worth the risk. I love being in recovery. I love being sober. If you're not there yet, that's okay. And I hope for you, and I know that for you, someday, if you keep working hard on the way that you think about addiction and the way that you think about your ability to take control of your life and move towards the things that you want in your life, that you too can appreciate recovery so much that whether addiction is a disease or an aardvark or whatever becomes irrelevant because you're just living your best life sober.